what do you see is missing or should be should evolve in the way that robotics is done in ear surgery? What's the future for you?
So there's many aspects we can improve. First of all, we are working on a combination coupling of the robot with navigation system. Navigation system of the lateral skull base is not so easy because most of the navigation system use the face for a surface registration. And the lateral part of the skull is pretty flat, except the pinna. But the problem with the pinna is that the position of the pinna will change between the CT scan and the operating room. So it's not a good landmark. So that's why we usually need fiducial markers like screws to try to raise our accuracy on the lateral skull base. So that's one of the part we're working on the robot. The other work we're working on is to give the robot some micro-forceps, which is not so easy, in fact, because we have some micro-forceps in otology, but we need to improve them, especially the mechanical aspect, because when you consider a robot-based assistance, you want the forceps to work in the same manner every time, because you want to have the same input in the actuators and motors to open or close the tool. And these micro tools are very hard to shape and build. And actually, there's only a few manufacturers that can guarantee this kind of accuracy during design. So this is another step we're working on. And the last step we're working on is how we will try to inject drugs or even genetic therapies into the inner ear. So this is going to be the next revolution in our field, how we can improve hearing through gene therapy, instead of cochlear implantation for people who have genetic disease of the ear.
That's fascinating. I was discussing with another company based in Montpellier who is doing immunotherapy for cancer treatment, but I didn't know there was this kind of gene therapy for the ear that would basically restore those cells that help with the hearing process, right?
Exactly. That's what we hope. Some children and some people, they just lack one protein. And if we can improve the function or give them back this protein, we may restore the hearing. So in a world change, there is just a small gap, and if you can just fill the gap, maybe we can have excellent results. But we don't know. It's good. I mean, it's the future. We have to test. It's working in animal models. We have excellent results, but we're not in clinical trial yet.